Hello, welcome to the Schoen Clinic. My name's Colin Natali and I'm a spine surgeon. I've been a consultant for 22 years and most of my days are spent dealing with people who have neck and back pain. This talk is aimed at patients who have pain, HR managers and line managers. And the reason is because there's a lot of concern about back and neck pain, about what caused it, how can I deal with this acute episode, and what can I expect in the future. And now for the disclaimer. This video doesn't preclude a visit to an expert if you're worried, and it's not a substitute for a face-to-face visit. Remember that back and neck pain are generally very simple things to deal with, and you need to deal with them in the workplace, for yourself personally, and that being passive is a recipe for failure. Now for some potentially serious stuff. Remember that most neck and back pain is not serious, but we use a series of flags to decide whether it is serious, and these we call the red flags. Red flags are a series of symptoms that warn you that something more serious is going on. Red flags include the first episode of back pain under the age of 15 and over the age of 55. Having night pain, but that needs some qualification because most people that have back and neck pain will realise that they do get woken by the pain. When we talk about night pain, we talk about a continual pain that just is non-remitting. It continues. Bladder and bowel disturbance are important symptoms. That's not just the constipation that you get with codeine. It's loss of continence, so incontinence of urine and incontinence of feces. Numbness around your bottom, which we call perineal numbness, is a serious symptom. So are weight loss and night sweats. Progressive numbness or weakness in your upper and lower limbs are obvious serious symptoms. The history of a fall or the past history of a tumour. So if you're worried, consult your doctor. But what that leaves us with mostly is mechanical neck and low back pain, which I'd like to deal with in more detail. It's the pain you get when you're sitting, when you're standing, when you move, or when you lift objects. Mechanical neck and low back pain is due to disc dehydration. The intervertebral discs are those areas of your spine between the vertebrae that allow flexibility. This dehydration hasn't occurred because you haven't drunk enough. It hasn't occurred because you've sat in the wrong chair, your desk is at the wrong height. It is a genetic phenomenon and it starts early. It starts in your teens. What I'm going to show you is an MRI scan of two patients who are 35 years of age. One has back pain and the other doesn't have back pain. And I'll show you the first one that has no back pain. This is an MRI scan and these are the intervertebral discs. An intervertebral disc is an amazing structure. It's like a cross-ply radial tyre. It has an outer core that is hard but flexible and an inner part which is like crab meat. It's not liquid, it's not a gel, it's a solid, but it allows some flexibility. And in a normal MRI scan, the discs have a white inner. That means they have a high water content. I'm now going to show you another MRI scan of a 35-year-old. This 35-year-old has back pain and you will see that these discs are normal, but within the low back, all of the discs are abnormal. That abnormality is not because they sat in the wrong chair, because they bent too much or because they lifted things. It is a genetic phenomenon. It's what they inherited from their parents. This is why this person has symptoms, and this is why this other person, who has normal discs, has no back and neck pain. So remember, this is pain in your neck or your low back. It can radiate into your shoulders or into your thighs. It can occur with prolonged sitting, prolonged standing, or with movement. Remember that it's genetic. It's one of those things. So we've excluded red flags, and we know we're dealing with mechanical neck and low back pain. And I want to talk to you about the treatment options because they're easy and there's only 5 of them. And the 5 are do nothing, have painkillers and have physiotherapy. And the good news is that 90% of people will get better with those simple measures. Doing nothing is simply leaving it alone. Having painkillers are either the painkillers that you can get over the counter, such as paracetamol and ibuprofen, and you can even get paracetamol and codeine over the counter. If that doesn't work, you can visit your general practitioner and your GP can prescribe stronger painkillers, paracetamol with high-dose codeine, or non-steroidal medications such as naproxen and diclofenac. If that doesn't work, you can be referred to a physiotherapist, an osteopath, or a chiropractor, and there's a lot of debate about which one is the right one, but it's whichever is right for you. A physiotherapist, an osteopath, or a chiropractor will give you regular treatment sessions over a period of time, but remember that 90% of people are going to get better with these very simple measures, not going off work, but just managing your pain with a combination of painkillers, exercise, and physical therapy. If that doesn't work, you return to your general practitioner and you get referred to a specialist so that you can find out what the problem is. And at this point, the specialist may say to you, you need an injection or you need surgery. Injections are simple, they're performed often under sedation, so it's a half-day or a day case in a hospital, and obviously operations carry with them a longer period of disability. Overall, the important message is that if you've excluded red flags and you have mechanical pain, you can simply modify it by taking painkillers when it's bad, performing regular exercises, and taking regular breaks at work. It doesn't require you to be off work for the majority of cases, and you can simply manage it through these really simple measures. I just want to talk about exercise in a little more detail. Exercise can either be supervised or unsupervised. Supervised, that's with a physiotherapist or an osteopath giving you a set of exercises, or unsupervised, where you do them yourself. Now, in order to help people, I put some exercises on the internet under You Fix You. That's the letter U, fix, and then you. Whatever you do, you have to be committed to those exercises and do them on a daily basis. And you keep doing them until your pain goes. Remember that 90% of people are going to get better with these very simple maneuvers: oral painkillers and self-performed exercises. If you don't get better and you end up going to see a specialist, you may end up having injections, which is why you will end up somewhere like this. The other thing to remember is that recurrence is common. There's a 2/3 recurrence rate for people who have low back pain. And what that means is that if you have an episode one year, you've got a 2/3 chance of having another episode the next year. That's important to remember, because each time you get an episode, you have to treat it exactly the same way. Do nothing, take painkillers, and do your own exercises. That way most people can manage their back pain on their own without resorting to seeing their general practitioner or a specialist. Here's a thought. The spine is one of those parts of the body that's associated with negative language. You turn your back on someone, you stab someone in the back, they're a pain in the neck or they're spineless. And because of that, there's a lot of concern about spinal operations. You want to know if you're having the right operation by the right person, and are my symptoms bad enough to have that operation? And through Canada Life, you have access to best doctors, which will give you a second opinion and give you peace of mind. What we've dealt with so far is mechanical neck and low back pain that you can deal with yourself. Oral analgesics, self-performed exercises, maybe some physiotherapy or osteopathy. There is no doubt, however, that there are a group of patients where the pain is very severe and these methods haven't worked. And for that small group, you may have to have a period off work. But just remember, this is a really small group. There are two things I'd like to round up with. The first is hurt and harm. They're different words. If you do something, you can hurt yourself. So if you lift something heavy, your back may hurt. And harm. Harm is different. By doing something and you get pain, you've not harmed yourself, you've hurt yourself. And it's very important to differentiate between these two things. The second thing I'd like to discuss applies equally to home and into the workplace. And that is, how do we reduce the frequency of any recurrences of back and neck pain? How do we decrease the duration and decrease the severity of that pain? Because they're important concepts. We can decrease the frequency by maintaining a good level of activities, and that is doing your exercises when your pain comes on early. We can decrease the frequency by instigating those treatment plans that I've told you about early, that is, taking painkillers and doing your exercises. And by doing all of those things, you decrease the intensity of any pain that you get so that you can manage it. You can self-manage your condition. Overall, remember that back and neck pain are common. You have to exclude red flags. It's mostly genetic. You have to reduce the risk of episodes and act early to reduce the pain. Take action to prevent further attacks and take control. And remember, ask for help if you need it. As Winston Churchill said, there are two types of people in this world: those who have back pain and those who are going to have back pain. By watching this video, you should have enough information to take care of your spine. You only have one spine, so look after it.